It has spread far and fast, turning cities into ghost towns. All of Europe now fighting against the invisible virus. Millions of families across the continent forced to take shelter. Among them, the Lippert family, originally from Boston. They now live in Paris.
I want to let you know you're coming back to a really different Paris. It's lockdown.
The father flew to New York to pick up their daughter from college.
Being separated in a pandemic is not the best way to go about it.
Now they're trying to get back with many transatlantic flights cancelled.
My most important priority right now is to get us back together.
The stores are also all closed in the French capital, except for the food stores. In Italy, the Pope, walking almost alone, blessing an abandoned St. Peter's Square. Next month's historic Easter service will be live-streamed. The number of deaths here in a day, 368, surpassing China's record. NBC's Matt Bradley is in Rome.
Intensive care units at hospitals like this one are almost full, and experts predict that 4,000 beds are going to be needed in a matter of weeks.
And Europe's experts warning that may just be the start.
It is extremely serious because out of every 100 people who we know get the disease, about 20 of them get severely ill.
Spain's streets nearly deserted. Police urging people to stay inside.
We cannot get food. The restaurants are closed.
Stranded in London, this mom and 5 children from Orlando spent all day yesterday trying to book an earlier flight home. There were no seats.
And not knowing when we can get back or if we're going to be able to get back is really very stressful.
They're going to have to wait it out.
Arguing a bit in the car. It's just like, it's super stressful. But...
You looking after your mom?
Yes.
Europe divided by the virus and united. People having to self-isolate, singing. And from Italian balconies to Spanish apartment windows, they clapped the health workers on the front lines. For a moment in Spain, doctors and nurses stepped out to return the applause, then got back to work.
Wow. Well, Keir, I understand the UK is trying something of a different approach to stem the spread of COVID-19. What's different than the guidelines that are happening here in the U.S.?
Yeah, well, rightly or wrongly, Savannah, that the British government here is kind of just trying to pace the country, if you like. So they haven't closed my children's schools or any schools. The restaurants are still open. One idea is that if the virus spreads, the country could kind of gain a kind of herd immunity. Conversely, Savannah, what they are suggesting is that people over 70 may have to self-isolate for maybe 4 months. You know, Savannah, my dad is in his mid-70s. He works. I was skiing with him just a few weeks ago. Imagine how he and so many others are going to feel about that. Savannah, you know, right now here, it feels a little like a tidal wave coming towards our communities, and we can't escape it.
Yeah. It's an interesting theory, actually. Maybe we could look into it more, because my understanding was one of the reasons why we're taking such dramatic action here is because of the fear that the healthcare system will be overwhelmed. So yes, herd immunity is a good idea, and maybe at some point our country will have herd immunity, but in the short term, our hospitals can't handle the onslaught if there's a huge peak in cases.
And you do wonder if London may be better prepared in that department than we are. I mean, we were talking about the fact that we don't have an adequate number of beds and ventilators and all those things. They're trying to go into production on that.
Yeah, another big part of the story that we'll continue to follow.